Hello friends, let us now learn some important points about the next disease, that is Meconium syndrome. Meconium syndrome is a group of gastrointestinal disorders which are seen in children, and this is most commonly associated with cystic fibrosis. So in Meconium syndrome you have two main manifestations are seen in Meconium syndrome. One, we have Meconium plug is present, and second we have, this is first type, second type Meconium plug, second type is we have Meconium Ileus. This Meconium Ileus can be simple or it can be complicated. So first and foremost we will see Meconium plug. Okay, so this Meconium plug, this is the frequent cause of neonatal intestinal obstruction. It is the frequent cause of neonatal intestinal obstruction. Okay, this is associated with maternal diabetes mellitus, hypothyroidism, cystic fibrosis, and it is associated with Hertzsprung disease. So this is associated with maternal diabetes mellitus, hypothyroidism, Hertzsprung disease and cystic fibrosis. Then if you see the clinical features, this is seen in preterm infants where you see distal bowel obstruction. Because of distal bowel obstruction, the baby presents with abdominal distension is seen. Right? And what is this Meconium plug syndrome? In Meconium plug syndrome, if you see, this is the bowel, right? In some part of the bowel, the meconium gets obstructed here. Okay, that is Meconium plug syndrome. Because of this obstruction, you will see presence of clinical features like distal obstruction, or you will also see the presence of the baby presents with abdominal distension, and distal bowel obstruction is seen because of this plug. Okay, then how are you going to diagnose it? Diagnosis is, you can do abdominal x-ray. In the x-ray abdomen, you will see the presence of dilated bowel loops are seen, and the investigation which is both diagnostic and therapeutic is water soluble contrast enema, and the contrast used here is gastrographin contrast is used in this situation. This is water soluble contrast enema is done where gastrographin contrast is used. Once you give this enema, the Meconium plug will pass through the stools, and this will Meconium plug passage occurs, and this will relieve the obstruction. So this is about Meconium plug syndrome. Then we have second type, which is called as simple Meconium Ileus. So if you see in the simple Meconium Ileus, here this is a type of neonatal intestinal obstruction which is seen in patients of cystic fibrosis. And if you see, the earliest clinical manifestations are simple or complicated. In simple Meconium Ileus, this occurs in the first 24 to 48 hours. Here there will be generalized abdominal distension is seen, and the child will have bilious vomiting will be seen, and there is also failure of passage of meconium is also seen. So in the child, within first 24 to 48 hours, you will see presence of generalized abdominal distension, bilious vomiting, and failure of passage of meconium is seen. Clinical features include, you will see presence of terminal dilated ileum. Okay, you will see presence of terminal dilated ileum, and in this ileum you will see presence of like inspissated meconium. You will see meconium which is inspissated here. Thick meconium is seen. Thick tar like meconium is seen, and even small pellets of meconium is seen. distal to this ileum, the colon which you see, normally colon should be very big, right? But here the colon will be small. There will be small colon, and here the ileum is dilated because of the meconium pillets. Okay. Now, if you see the diagnosis, in the diagnosis the most important thing is you can do on X-ray. On X-ray you will see presence of dilated bowel loops are seen, and you will see on the X-ray presence of dilated bowel loops are seen, and there will be absence of air fluid levels. There will be no air fluid levels, and you will see presence of mass of meconium may be seen on the right side of the abdomen, which is mixed with mass, and this meconium seen on the right side of abdomen with mass gives an appearance of soap bubble or ground glass appearance. It gives an appearance of snow bubble or ground glass appearance. Then for diagnosis and for the treatment we use, similar to the meconium plug, we use water soluble contrast enema. This water soluble contrast enema with the gastrographin dye, it is treatable or it will cure in almost 75% of the cases. It will be cured. Okay. Now, this will relieve obstruction in almost 75% of cases. One important thing is this gastrographin which we are talking here, this is actually hypertonic to the patient, to the baby. So, as a result, you will have to first hydrate the child properly, then you can give this gastrographin. Okay, so this is one important thing. Then, in this we also have operative intervention can also be done. In operative intervention, here simple evacuation of meconium can be done with irrigation of proximal and distal bowel. You can do irrigation of proximal and distal bowel with warm saline, or you can also use 4% acetylcysteine can be used. With the help of 4% acetylcysteine or warm saline, we can irrigate the bowel. Then we also have some named procedures for this operation or surgery of meconium ileus, which includes Paul Miculus double barrel ileostomy. In Paul Miculus double barrel ileostomy, here you are going to open the ileus, you are going to open the ileostomy, two openings of ileum, see, this is the, I'll just draw, this is the ileum. You will resect it here and you will open it outside like this. So this is called as Paul Miculus double barrel ileostomy is done. Then second we have Bishop Coop's distal chimney ileostomy can be done. In Bishop Coop's distal chimney ileostomy, okay, here this is the one segment and you will resect the other segment like this. Okay, so this is Bishop Coop's distal chimney ileostomy. The last one is only name is important, which is Santhuli's proximal chimney ileostomy. In Santhuli's proximal chimney ileostomy, here we are connecting the proximal part of the bowel to the distal part of the bowel like this. See, in Bishop's Coop's, this is the colon. See, in Bishop Coop's distal chimney ileostomy, the distal bowel has come out as an ileostomy, whereas proximal part of the bowel is connected to this distal bowel. Whereas in Santhuli's proximal chimney ileostomy, here the proximal bowel has come out as ileostomy, whereas the distal bowel is attached to the proximal bowel. Okay, so these are the two different types of ileostomy. Then the advantages of the surgical procedure mainly includes they have lowest possible bowel resection. We do not need to resect lots of bowel, only the lowest possible bowel resection, least amount of bowel is resected. And then enterostomy is done. With the help of enterostomy, we can easily do irrigation to prevent for proper healing. So post-operative irrigation is easy with the help of this ileostomy. Next, after simple meconium ileus, we have complicated meconium ileus. This complicated meconium ileus means if the meconium ileus is complicated by perforation, then we call it as complicated meconium ileus. This perforation can occur either in utero or it can occur after birth immediately, or it can occur in utero. Because of this perforation, the child has peritonitis. In the beginning, there will be aseptic peritonitis. Aseptic chemical peritonitis is seen. Here, in the peritoneal cavity, there is meconium which is seen in the peritoneal cavity. Slowly, this meconium will either undergo calcification or it can form dense adhesions. If it undergoes calcification, on USG, you will see the presence of snowstorm sign is seen if the meconium undergoes calcification. Then if you see the clinical features, you will see adhesive peritonitis can occur, and there can be ascites, and sometimes there can be secondary bacterial infection can also occur. And one more important thing is there can be presence of meconium pseudocyst can develop slowly. Then what are the important diagnostic features? In the diagnosis, first we have X-ray abdomen. In the X-ray abdomen, you will see presence of specks of calcification with dilated bowel loops are given, and we have mass effect is also seen. And on ultrasonography, as I have already said, there will be presence of snowstorm sign is seen. Then if you see the management is conservative management, where we can give enema can be given to the patient, or we have to give polyethylene glycol solution can be given to the patient. These will help in irrigation of the small bowel mainly. So this is about the complicated meconium ileus. Thank you for watching.